New legislation could change the way you buy critical healthcare services.
It seeks to hold both healthcare providers and health insurers accountable amid a growing crisis in healthcare access. Political reporter Darielle Fair has the latest.
Advocacy groups in Wisconsin are revisiting the conversation on how the state's hospitals are currently providing accessible and affordable health care to patients. Legislation supported by Republican lawmakers aims to create more transparency around those out-of-pocket costs. A draft of the bill introduced in May requires hospitals to provide a list of the standard charges for certain procedures and services, allowing patients to make their own decision on what rates are most affordable. The bill would also require a similar list of rates for procedures that may be scheduled through a healthcare provider in advance. The Department of Health Services will be responsible for issuing written notices and fines for hospitals not in compliance.
Now nearly 3 years. Wisconsin is ahead of other hospitals across the country, with nearly 50% of Wisconsin hospitals showing their prices fully online. However, if another 50% aren't complying with this law of 3 years, well, that's a problem. And if we did have true price transparency everywhere and it was functional, we wouldn't be having this conversation.
Supporters of the proposal argue that federal law is not being enforced at the state level, calling for clear guidelines and regulations. Other organizations feel that hospitals across the state have continued to provide transparency in the pricing and quality of patient care.
Have a federal law in place that is being quite actively enforced by the federal government. This legislation comes on top of that. And at a time when healthcare and hospitals in particular are drowning in regulation and bureaucracy, we think it's absolutely unnecessary legislation. It will only further complicate what is already a massively bureaucracy-laden healthcare system where we spend so much money.
The legislation received its first public hearing in the Senate Health Committee, but has yet to be voted on in either the Assembly or Senate.